So the thing we have all been hoping and waiting for since last March, a COVID vaccine, is finally here. But many Americans still have unanswered questions like, how can I get it? Which one should I get? When will I be eligible? Is it safe? I mean, should I take it? And does it fully protect you? Well, that's why I invited a top-level expert here, Dr. Tony Mills, to join me today. Now, he's here to answer all of your questions. And Dr. Mills is the founder and CEO of the Men's Health Foundation, which was one of the very first sites selected by LA County to distribute the vaccine. Now, Dr. Mills is also actively engaged in clinical research for Johnson & Johnson's vaccine and vaccine administration for the state of California through the LA County Department of Public Health. He's also the principal investigator at Mills Clinic Research and has an extensive research background in the fields of virology and infectious disease. So he didn't just fall off a turnip truck, I guess is what I'm saying. He's also a member of the Infectious Disease Society of America, so this is right up your alley, Doc. Good to see you again. How are you?
Good to see you also. Thank you for having me.
Well, I'm glad to have you. There's so many questions about this, and a lot of people are saying that when it comes their turn, they're not going to take the vaccine. How do you feel about that?
I think, well, I've been so engaged in the effort to develop the vaccine. I think everybody should take it as soon as they get it. And I think that it's not just about the individual, it's about all of us. And so if everybody takes it, we're all protected sooner.
What are the people asking when they come in for the vaccine? Are they afraid because this was so fast-tracked, we don't have a long history with it? This vaccine is not far off from vaccines that we do have a long history on, right?
Exactly. So this uses a platform that we've got a lot of experience with. And I tell people this all the time, the vaccine was actually ready in February of 2020. It was so easy, they just slip in another viral vector and suddenly you've got the vaccine. So what took the year was doing the testing to make sure it was going to be effective and safe. But it's very quick and easy. We've advanced to this level in the technology to develop the vaccines.
Yeah. Do you get more side effects with one versus another We have Pfizer, Moderna, Johnson & Johnson right now. Those are the three, right?
Right.
Does one have more side effects than another?
I would say they're all really well tolerated, and the side effects are very, very few in all of them, especially with the first dose. I think the only thing that is a bit of a hurdle is the second dose for Pfizer and Moderna. Your immune system's all revved up from the first dose, and when we give them that second dose, sometimes they'll get some of the side effects, a little malaise, low-grade fever. So I think the Johnson & Johnson skips that a little bit because it's just one dose. So you have a little less side effects.
Someone in our virtual audience has a question. Sherry.
Hi, can you suggest an encouraging response I can provide family members and friends who are skeptical about taking the COVID-19 vaccine?
I think I would just reassure them how safe it is. I mean, we've done a lot of work. These three have been studied in over 100,000 patients worldwide, different populations, different ages. We always tried to test it in those people who were at highest risk for COVID, so people who were battling with obesity, people who had diabetes, Black and brown communities, older people, all those people we knew that were at highest risk of COVID. So it's very, very effective, and it's very, very safe. And as I said, I mean, I think it's a great way to protect not only themselves, to protect the other members of the family as well.
Amber has a question. Amber, where are you?
Hi. So I've heard rumors about it causing infertility. Has there been any studies done on this?
The rumor about the infertility happened because the vaccines all target what we call a spike protein, which is on the outside of the coronavirus. And there's also spike proteins that are in the placenta. So a woman who's growing a baby inside has spike protein there, but it's a totally different spike protein. So the antibody that you make whenever you're vaccinated to COVID has no effect whatsoever. And so, if, for example, the Pfizer trial, there were 26 women who got pregnant in the Pfizer trial, and there was only one baby that didn't survive, and that baby was in a placebo group. So that's the kind of data that we have. We'll get more data moving forward, but there's no evidence, there's no scientific reason that it should cause infertility, and there's no reason that women should hesitate to get it.
All right, coming up, more with Dr. Tony Mills and his tips on the best way for you to get your vaccine. That's next. I'm back with Dr. Tony Mills. He's the CEO and founder of Men's Health Foundation. He's been clearing up some of the misconceptions and fears surrounding this vaccine. You had no hesitation in taking it yourself.
I had no hesitation. I cried, Phil, when I was offered it and I took the vaccine. I teared up, and I think most of the people in our staff did the same thing. I mean, we've been working in fear for a year, living in fear, not being able to see our parents. So it's a great thing to get the vaccine.
Yeah. Well, Robin and I waited our turn until we were in the proper sequence and age group, and we've both had both vaccines, and we didn't have a reaction to the first or second. Arm was a little sore the first time. It didn't even get sore the second time.
No, but it was very sore the first time for me. But we were so happy that we didn't have any side effects for that second one.
Yeah.
'Cause we had been told that there could be, but we had nothing. We were just so happy.
So we've had both first and second vaccines, so we have that protection, but we're continuing with all the other procedures. We're continuing to wear masks, wash our hands, maintain social distancing. We're doing everything that we did before, just with more peace of mind.
Sure, sure.
But we want to do, everything we can. Will there be a time, is there anything on the books for any kind of immunity passport?
I think that the people who are vaccinated know they've got a strong level of protection. I haven't heard anything about what the airlines might be doing or anything. When you're vaccinated, you remember you got a little vaccine card that looked like something from the 50s. And I think it's so funny in this high-tech world that we live in that these vaccine cards are so important. So your information is also in a computerized registry, but everybody says hold on to those vaccine cards. We may attach them to our passport. That may be a way to get on the plane. We don't want to force people to take a vaccine whenever they don't want to get it. So I think that it's reassuring to know that we can assess our level of risk, and just in those situations where we can't control it completely, make sure everybody wears a mask, socially distances, and takes care of themselves.
Right. What are some tips on how to get the vaccine? What should people do to get the vaccine?
We have a centralized website now nationwide called My Turn, so people can log in there, and if you don't qualify now, you can put your information in, and then they'll reach out and contact you whenever your turn is available. It helps to pair you up with sites that are doing the vaccine, and then reach out to your private physician and talk to them and see if they can help to guide you a little bit.
All right. Do you think we're close to turning the corner?
I do think we're close to turning the corner, and I believe we're going to get out of this. I mean, these latest numbers with 27%, I think, of the American population having at least one dose. I see us building up herd immunity. We see it in the numbers nationwide. So I'm really excited. I feel very good about the future.
Very special thanks to Dr. Tony Mills. Please go check out the website for his foundation, menshealthfound.org.